Hello everyone and welcome to SHP Insight. My name is Andrew Butler and I'm Dean of the UAB School of Health Professions. Joining me today is Allyson Hall, who's a professor and director of our Healthcare Quality and Safety graduate programs, co-director of the UAB COERE, a research scientist, and a board member of the Commission on Accreditation of Healthcare Management Education. Welcome to SHP Insight. Thanks for joining me today.
Thank you for having me. It's great to be here.
I know you do a lot of work with the COERE. Can you tell us a little bit more about the COERE and what it's about?
Sure. The COERE actually stands for the Center for Outcomes, Effectiveness, Research, and Education. It's a university-wide center, and as the name implies, it's dedicated to improving outcomes or fostering outcomes research at our university. There are three main components to the COERE that we focus on. We focus on training, so we have an ARC T32 grant where we train pre- and postdocs. We also have a set of programs that are dedicated to enrichment of our faculty and our students around outcomes research. And that includes things like a component on implementation science that is actually run by Larry Harold, who's in our school as well. And then finally, what I'm actively engaged in is, and the newest component of the COERE, is the learning health systems component.
You are tasked with designing and implementing a learning health system. Can you tell me a little bit about a learning health system, why it's necessary?
Sure. I mean, the idea behind the learning health system is that we want to bring researchers and providers together at the bedside or at the point of care to really better understand what are we doing to improve quality of care. So sort of capture the learnings that are available to us, either learnings from studies or quality improvement activities, and then thinking about how we disseminate them back into our health system or externally so that we can improve care both within the health system and across the board.
So Allyson, what are some of the goals of the learning health system?
So some of the goals of the learning health system for us are intentionally to, again, bring our academic folks, those of us on the campus side, with the frontline providers to engage in rigorous evaluation, rigorous quality improvement activities that can benefit the health system. Key to that is being able to abstract and obtain data that can inform improvements, implement or foster good study designs, and then include a dissemination component, as I said before, thinking about how do we take those learnings, take those findings to improve care at UAB.
It's a really, really exciting initiative, and I can't wait to hear more about that. In 2018, you took over the graduate programs in healthcare quality and safety. Prior to that, much of your career was focused on patient experiences and outcomes. Tell us how you've grown the HQS program.
We have actively sought accreditation, and we are going to be the first HQS program, graduate degree program in healthcare quality and safety to be accredited by CAHME. And what that means for us is that we are becoming much more intentional with developing core competencies for our healthcare safety, quality and safety professionals.
So I know the accreditation is really important. It's the first program in the country to have that. Healthcare quality and safety is a rapidly growing area. What else sets our HQS program apart from the rest?
One of the things that sets us apart is that our students come from a variety of disciplines. What we hear from our students is that they love the fact that there could be a unit clerk who's had lots of years of experience in the administrative role working with an accomplished surgeon. And the two of them get to talk about how they're going to improve care within their own space. So I think that sets us apart. I think the second thing that sets us apart is that we are closely aligned with a healthcare system. There is an actual laboratory for where our students can begin to learn and practice their craft. I think the third thing is that we are an online program, and there are many other programs that are online, but what we do, and what I insist that the faculty do, is find creative ways and very intentional ways to engage with students. So they're not just a face in the Zoom room, but we know our students very, very well. The other thing that we insist upon is that we hold a couple of live synchronous sessions. And again, there's a process for engaging, or a way for students to engage actively with their faculty and with their other students. And of course, our faculty. Let me not forget that our faculty, I think, are exceptional and very much dedicated to their students and to improving quality and safety in general.
It's absolutely fantastic. And there are quite a lot of unique things about this program, being all online, being able to capture lots of different people. So great work in that area. In addition to co-directing the COERE and running all the HQS programs, you study delivery systems, patient-centered medical homes, Medicare, people with disabilities, and individuals with other sorts of disabilities. What discoveries are you seeing in the field that really excites you?
Oh my gosh, certainly my old work when I was at another university on looking at policy evaluations, I think not so much a discovery, but a realization and something that I'm translating into the classroom. And what I'm translating into the classroom is that if we want our work to be applied, we've got to engage with stakeholders. I think in terms of some of my more current work, I'm doing a lot of work on COVID. And one of the key things that we were working a lot on is trying to understand vaccine hesitancy and testing hesitancy with regard to the pandemic. And some of those learnings will be translatable to some of the learning health system work as we try to engage folks in taking care of themselves.
So, Allyson, March is Women in Leadership Month, and as one of our leaders in the school, as one of our women leaders in the school, you've had a fantastic journey. Can you tell us a little bit about your journey?
Sure. My journey, I would certainly let me tell you a little bit about my journey as an academic and some of the things I've learned from that part of my career. A couple of things. I think one, go down every path that is offered to you until you cannot go anymore. And I know in academia, we're often trained to stick to our discipline or stick within our specific bucket. But I have found that my career has been enriched when I've taken those opportunities that I perhaps in graduate school would not have taken up. Number two, I think it's really important to figure out who your mentors or your sponsors are. And your mentors or your sponsors may not be the folks that you actually think they will be. Traditionally, African American students may look for somebody who looks like them to be their mentor. My mentor at the University of Florida, I will say, is an older white gentleman. And to this day, I still call him up when I have problems or concerns. And so I think that's sort of the second lesson that I have learned in my career. And the third lesson, which is sort of related to the first lesson, is again this interprofessional nature of what you do. Find your team. Not just the one individual who's going to support you, but your group who's going to support you. And again, they may be very different. They may have very different research questions, research trajectories, academic trajectories, but engage with all kinds of people. And then the fourth thing that I have sort of thought about in terms of my career is pick your battles. Not everything is a fight. Some things you can let go and some things are worth fighting about. And so think strategically about what you're doing.
All of that is just wonderful advice. So, Allyson, thank you so much for joining us today.
Well, wonderful. It's great to do this, and I'll take your line. Go Blazers.
Turning to SHP News now. Congratulations to Laverne Smith, the first-year dual-degree student in MSHA, MSHI, has been awarded the HIMSS Foundation Scholarship. The $5,000 award is only given to one graduate student each year. I'm pleased to announce Mohan Thirumalli as our school's first Director of Performance Analytics. He will be working with all departments to guide and maintain a holistic vision of the future of data management and analysis strategies in the school. A study published in the journal Obesity suggests weight loss may take longer than expected due to metabolic adaptation. The lead author is Katya Mertige, an associate professor in our Department of Nutrition Sciences. You can read about these stories and more by visiting go.uab.edu/SHP News. Again, thanks to Allyson Hall for her time and insight into UAB COERE and our healthcare quality and safety graduate programs. And of course, my thanks to you for watching. Until next time, as Allyson said, go Blazers!